welcome to You Didn't Get the Memo 2022. Happy New Year to you guys. I'm excited that you decided to join us. And as always, look, we're kicking off 2022 with fantastic shows, even better than what you saw in 2021. So be sure and tell someone. But I want to thank you guys again for tuning in to You Didn't Get the Memo. I'm your host, Gloria Bailey Ray, and our show is about providing you, the viewer, with relevant, factual, mainstream information to help you be informed and to make informed decisions. We air live every Tuesday, you guys. Get that on your calendars. Every Tuesday, 5 p.m. Pacific Standard Time. We're streaming live on Facebook, YouTube, LinkedIn. So, I want to let you guys know that today's show has actually been brought to you by one of our sponsors, Tahimba and Associates. You Didn't Get the Memo is an interactive show. So if you have questions or comments for my guests, please place them in the comment section. We'll do our very best to respond to them. Look, I always like to give a quick shout out to all of my viewers nationally and internationally. Again, I'm grateful. Thank you. Thank you for tuning in. My guest today, you guys, is Miss Leslie Oldershaw. She's the medical director and she's a licensed acupuncturist of the Oldershaw Clinic. Now, you may be saying acupuncture. Listen, y'all. I'm about to make your life better. Because, first of all, acupuncture is an ancient system of healing that's been used to restore and maintain health and wellness, or well being. It's been practiced and refined in China and other Eastern European countries. And it has a history that dates back to at least 2,500 years. So, acupuncture is used mainly to relieve discomfort associated with a variety of diseases and conditions, which we're going to talk about with my guest today, Miss Leslie Oldershaw. So, I want to welcome to the show Miss Leslie Oldershaw. Thank you so much for joining us. I'm excited to have you on the show and to talk about all of these wonderful benefits that our viewers are going to be able to get some answers to and to get relieved of that they may not have even been aware of. So welcome to the show.
Thank you, Gloria. I'm excited to be here, and I really appreciate you inviting me on.
Absolutely. Well, listen, I always like to start with this. First of all, let's tell our viewers about your backstory. How did
Okay.
you become involved with acupuncture? But pretty much, a little bit about who Miss Leslie Oldershaw is. So tell our viewers who you are.
Sure. Well, I went to college knowing that I wanted to go into the practice of medicine. And so I went through as a pre-med, and I decided that I wanted to explore some other options besides being a conventional Western MD. Um, I really wanted to have a practice where I could spend more time really getting to know my patients and working with them over time, rather than being in a practice where maybe I see a patient once a year, but I don't have, that kind of closer working relationship with them that I was really interested in. So I spent a little bit of time seeing what other ways you can practice medicine, and Chinese medicine was something that I discovered, and I decided to pursue that for my career. And it turned out to be a really great choice because it's allowed me to really work with patients where I'm seeing them on a somewhat regular basis. So I really develop a relationship with them and really help them make some big changes in their health and well-being.
Well, I can personally say that I know the difference acupuncture can make in your life. And before we went live, one of the things I said to you, I think back to when I met you years ago, and you probably met me at one of my worst possible moments in my life. But I know and I feel like acupuncture saved me. And one of the things you heard me say when I opened the show is that we strive to provide, fact-based information to people to help them be informed and make informed decisions.
Mm.
So thank you so much for talking about and giving us that background in regards to what it is and how you got into acupuncture. So here's the big question. People are saying,
Okay.
what is acupuncture? How does it work, right?
How does it work?
Right.
So,
Because people have all these things going around in their head about acupuncture and probably the farthest thing from the truth. So let's start with that. What is acupuncture? And then let's move into how does it work?
okay. So acupuncture is originally from China and it's been around for a long time. We know at least 3,000 years, but possibly more, like 5 or 7,000 years. And it is essentially using needles, very, very small, thin needles, um, to address the body and work with getting the system to work correctly. So we see the body as having a circulatory system that we know of in Western medicine, that is your blood vessels. And in Chinese medicine, we see a circulatory system that, very much like the blood vessels, goes everywhere in the body. And when there is any kind of stagnation, whether you're talking Eastern or Western medicine, that's not good. And you'll see stagnation. A symptom might be pain or swelling or redness. You can think of, if your knee or ankle are injured, they swell up, they turn red, they hurt. That's a form of stagnation. And acupuncture uses these very small needles placed along the meridians, which are those circulatory vessels, to help relieve the stagnation and get your body's energy and blood and fluids moving, which supports the healing process.
Okay, because I was going to say, okay, stagnation.
Mm.
When people hear that word, what is that?
Mhm.
So thank you for explaining that. And just that whole inflammation piece, it's
Yeah.
amazing. So, y'all listen, I'm
Yeah.
telling you, Leslie is giving you some great information. So, Leslie, is acupuncture safe? We've
It's
heard
very
a lot
safe.
about that, and people
Yeah.
go, "Oh no, I'm not
Yeah.
doing that." And
Yeah.
so you just said it's been around for 3,000 plus years, probably
Yeah.
that we know, but it's also very safe.
It's
So
extremely safe.
okay, okay. So let's talk about then what are some of the
Mhm.
benefits of acupuncture? Because I know people, I'm seeing people, by
Mhm.
the way, thank you guys so much for being here on
Mhm.
YouTube. Unfortunately, I'm not able to respond back to
Mhm.
you on that, but Facebook, I see you guys and thank you for being here. But you talk about
Mhm.
acupuncture. So, what are the benefits, or what are some of the benefits of acupuncture? And I know it's a list, but let's just kind of
Right.
just delve
Right.
into and talk about the benefits of acupuncture.
Sure. Well, probably the best known benefit is that it's really great at treating pain. So if you have an injury, like you've sprained your ankle, or you've broken your leg, or you've had knee surgery, acupuncture can do a lot in the healing process to relieve the pain and help repair the injury or the post-op recovery. That's probably what acupuncture is best known for, is that treatment of pain, and it can be very, very effective. It also is very safe. It doesn't have the same kind of side effects that you might get with pain medication. And the thing that's true about acupuncture is it can be used in combination with anything else you might be doing for the pain. So if you are taking pain medication, whether it's over the counter like aspirin or ibuprofen, or something that might be a prescriptive uh, medication, you can combine that with acupuncture to get the best relief possible.
Yeah.
The thing that we get a lot of feedback from our patients is how much they appreciate acupuncture as a way to manage and relieve stress. Like coming into our office, it's like going to a day spa, right?
Right. Absolutely.
And so that's something that everybody will experience and benefit from when they get acupuncture. My practice in particular, I am a women's health specialist, so we treat women's health and fertility, and so there's a lot of different things that come up for women that acupuncture is really great at treating, whether it's fertility challenges or uh, uh, PMS or uh, anything that might be interfering with their ability to get pregnant. Acupuncture is great at treating a lot of different women's health issues as well.
Okay, we have a
Yeah.
couple of questions from the viewers, so I'll start
Sure.
with this one. One
Okay.
question is, do you have to keep coming back for treatment?
So generally, the short answer is yes. Acupuncture is generally not a one and done kind of treatment modality. So our patients may be coming in anywhere for 6 to 10 visits. Or if they are, for instance, a fertility patient, we might be working with them for a few months during the conception phase, and then we might work with them for 9 months while they're pregnant. So depending on what you've got going on, it will take more or less acupuncture sessions in order to treat it.
Mhm.
And then for a lot of our patients, once they get better, they may elect to come in and see us for monthly tune-ups, just for a wellness session, relieve some stress, keep them feeling good. So
Yeah.
it really depends on the patient and what they are, what's going on for them. So when we meet with patients in our clinic, you come in for an initial visit, we get a full history on you, and then we develop a treatment plan and we let you know what we think we might be looking at based on our experience and what your presentation is. And then we go to work and we see how quickly things turn around.
Yeah, awesome. All right. Thank you. We got another question. Does it help with neuropathy?
It can help with neuropathy. It will depend, again, on what's causing the neuropathy. And it may be something that we're able to reverse completely, or it may be that we are helping to manage it so it is reduced. But we don't know until we meet a particular patient and we see what works, how what the results are going to be.
Okay, that's definitely fair. And it does make sense. It's like anything else. If they were going to see their primary care physician or a specialist, there's still a process. You have to figure out, the patient comes in with a complaint, but
Yeah.
you're trying to decide and determine, all right, what is it that's going on? And you're asking all these types of things. And I look, okay, I'm going to ask this.
Okay.
We've got one more question, and then we're going to take a quick break. And when we come back, we're going to keep it rolling. So, guys, keep your questions
Okay.
coming. This question says, does it help with arthritis?
It can definitely help with arthritis. And with arthritis, it's generally a chronic condition. We're not going to necessarily cure it with acupuncture, but we can do a lot with acupuncture to help manage the pain and make it so that the arthritis is less of a problem. It doesn't hurt as much. You don't have to take pain medication or as much pain medication to manage it, and you can generally have a lot more mobility and function in the joints that are affected.
Yeah. And I can definitely attest to that. I know that that's a huge issue, notwithstanding the other benefit of just feeling less stress. Because when you're in pain, you also have stress. So that's the other thing. But guys, thank you so much for your questions. We're going to pause for the calls right now. We're just going to take a really quick break. But when we come back, continue to put your questions in the comment sections and I'll share those with Leslie. And when we come back, Leslie,
Mhm.
let's talk about if there are any risks associated with acupuncture as
Okay.
well. So we'll be right back. You guys don't go anywhere. Thank you so much for hanging in here. I appreciate it.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
you will see me.
As a son.
As a man with a never quit attitude.
As a fighter for change.
Join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
that has the power to make a big difference.
Roll over. When you adopt a shelter pet, you discover all the things that make them unique.
And your mother.
They're a little bit of a lot of things, but they're all pure love.
All right. If you guys are just tuning in, you are tuned in to the You Didn't Get the Memo show. I'm your host, Gloria Bailey Ray, and my awesome guest is Leslie Oldershaw, who is the medical director and a licensed acupuncturist with the Oldershaw Clinic. So, Leslie, before we went to break, one of the things that I said when we come back, we're going to talk about if there are any risks associated with it. And I see your comments, you guys. Thank you so much. I will definitely share them with Leslie. But let's talk about any risks. What are the risks? With anything, we know that there's probably some type of risk, but would you share with the viewers what the risks may be with getting acupuncture?
Of course. So generally the risks associated with acupuncture are very low. The thing that everybody asks about is, does it hurt? And the fact is, it doesn't hurt very much. The needles that we use are very, very small, maybe about the thickness of a hair. And so you might feel a little prick or tingle as the needle goes into the skin. The needles don't go into the body very deeply, maybe just a quarter to a half an inch. And probably the biggest risk might be there will sometimes, not very often, but sometimes you can get a little bit of bruising right around the site of the needle insertion if it nicks a blood vessel. But that's not very common. So really, as medical treatments go, there are not a lot of risks or side effects associated with acupuncture. And that's one of its great strengths, is that it's something that you can use. And if it works for you, that is a great thing. And it doesn't have a lot of side effects or negative interactions with other medications or treatments that you might be pursuing. So it's a really great way to support your health and healing that's not going to be counterproductive with any kind of negative side effects.
Yeah, I think that that's one of the great benefits is people who've been on a lot of pain medication. And of course, what's been in the news for years is, the whole codeine issue. And look at what's happened in this way. You're talking about an alternative that has very, very low risk, if very low. And look at the benefits that they so outweigh any kind of risk that you could even think of, and notwithstanding the opportunity to reduce so many medications. And we all know the side effects, whether you're taking ibuprofen, if you're taking Advil, Aleve, all of those things tend to mess with your stomach. So, it's so many problems with your taking Western medicine too. And I'm not knocking it, so you guys don't beat me up. We're not saying that at all. but to have an alternative. And if you're like me, I'm like, look, I'm taking too many flipping pills as it is. So I don't want to add another one to it. So I think that that's a great way, and it's a great alternative as well. We did have another comment.
Sure.
Does your insurance pay for this?
That's going to depend on your insurance plan. I would say about half of our patients are getting benefits so that their visits are covered. It just really depends on your insurance plan.
Yeah. Yeah. And look, if I can say this, this isn't a plug, but the reality of it is you got to weigh, if you really want to get rid of pain and you want to get healthy, even if you got to come out of pocket. I think at the time when I was seeing you, it was out of pocket, but I had to weigh, do I go get my nails done? Do I come and get an acupuncture treatment? And I chose acupuncture treatments. And so it's one of those things, but that is great. And it also forces people to look at their health plan and see what they have. So and when you're choosing, that's one of the things. You know what? I want to be able to have that benefit of acupuncture as a part of my plan as well. So some consideration there, guys, for you to think about. So for what that's worth. Thank you, Leslie. So let's talk about acupuncturists and being licensed, right?
Okay.
Because people want to know that. So are acupuncturists licensed?
Yes. Now that can vary from location to location. So I'm located in California in the United States, and in the state of California, we are licensed as primary care providers, and we go through a 4-year graduate school program. After which we take board exams, after which we get licensed, and then we have to renew our license. Here in California, we do it every 2 years, and that includes a requirement for ongoing continuing education.
So in case you guys are wondering, you got the answer right there. So, as a licensed acupuncturist, and I think that the caveat that I would like to add here, Leslie, is it's important that you also check out and inspect. If you're going to see someone, you want to find out if they are licensed or not. So, and that's something that people can easily do. So make sure, if you want to know if the person that you're about to see is licensed, then you do that. Now, because you heard Leslie say she's here in California, but different states have different rules. So just find out and do just a little bit of research. You let Google. I think we all live with that. What are the parameters around licensing for acupuncturists in your particular area, right? So with that being said, but let's talk about your license. But would you say that acupuncture and Western medicine, are they aligned?
I would say they are aligned. Certainly in China, they are practiced in a highly integrated way, so that doctors in China, many of them are trained in both what we consider Western medicine as well as acupuncture. And so the two systems of medicine, Eastern or Chinese medicine and Western medicine, are highly integrated, and they combine together very nicely. So in my practice, we say we practice integrated medicine because we do a lot of Western medicine. We're licensed as primary care physicians. We are able to do lab work. We're well trained in Western medicine and modern medical Western medicine science. And so a lot of the work that we're doing with patients is a very integrated approach, where we are tracking what they're doing in terms of Western medicine, and then we're also treating them with acupuncture. And they go really well together. We find that the acupuncture can very much support what they're doing in Western medicine. If I had to say, how do they differ? Western medicine is particularly good at treating acute situations. So if you were to break your leg, you would want to use Western medicine to get the x-ray and do any surgery that was required to repair it and wear a cast. But for handling the pain and helping in the recovery and rehabilitation process and getting your leg back to full function, you're also going to want to bring in things like acupuncture, which is going to help you with the recovery. So acupuncture helps to, I think, treat things that can be more chronic and require that kind of ongoing attention to really get you back to 100% function.
Mhm. Yeah. And, that brings up a question for me, Leslie, when we think about that, wouldn't it be great? And that probably happens in some cases where your PCP, your primary care physician, also works in conjunction with the acupuncturist.
Yeah.
And so it's a win-win situation. And
Yeah.
I don't know how much of that you actually see in your practice. And you've been doing this for a very, very long time. So, and that's a compliment.
Thank you.
Okay.
Thank you.
But I
So-
know that you have the history around that. So what are your thoughts in regards to, working together,
Yeah.
Western medicine and
Right. I'm a huge fan. So in our practice, we're doing women's health. And so we're generally working, closely with the patient and their OB-GYN. And then because we're doing a lot of work with patients who are actively trying to conceive, we're also working very closely with their fertility doctors. And then once they're pregnant, we may be working as well with a midwife if they're choosing to work with a midwife. So in our practice, our approach is highly integrative, and we work closely with a team collaboratively, so our patients are getting well-rounded care from all of us.
Oh, I love that. So for the females, the ladies who are wanting to get pregnant, right? Here is an alternative. It's something worth looking into because I know that people spend thousands of dollars for trying to do in vitro fertilization, all these fertility things. And it could be something as simple as tweaking, something within her body. So again, for those of you who are thinking about it, it's worth a shot to do some research. So thank you. I think that's huge. That is huge. I love that. I love that.
Yeah.
So when we talk about Western medicine and traditional Chinese, well, I should say Western acupuncture and traditional Chinese acupuncture, do you really see that there's a really big difference? And if so, what might that be?
Gloria, can you repeat the question? Because I didn't quite understand it. I'm sorry.
Yeah. What's the difference between Western and traditional Chinese acupuncture, if any?
Oh, you mean what's the difference between practicing acupuncture here in the West versus traditional acupuncture as it might have been practiced historically in China?
Yes, yes.
I would say the biggest difference is that historically in China, acupuncture was the main form of medicine. It was the only thing you had. Here in the West, we're practicing acupuncture always in conjunction with Western medicine. All of our patients are currently seeing a Western medicine doctor, and for most of our patients, we are working in combination with their Western medical doctors, so that we're combining the two, we're integrating the two, and so I would say that's probably the biggest difference is that in today's world here in the West, and this is true in China right now as well, is that in today's world, acupuncture is being integrated with Western medicine, whereas historically, 100, 200 years ago, in China, what you had was acupuncture and Chinese medicine only.
Yeah, and that was it. So, I love that. So Leslie, look, we're going to take a really quick break.
Okay.
But when we come back, listen, I'm going to pose this question to you and allow you to, of course, you don't need to reflect on it, but you know what's coming. But what can a patient for the first time expect when getting acupuncture. So we want to talk about that and kind of alleviate any concerns that people may have if it's their
All right.
first time visiting an acupuncturist. So you guys don't go anywhere. Keep your questions coming. I really appreciate it. We will be right back.
You told me not to talk to strangers. You told me not to cross the street without looking both ways.
You told me not to touch the stove.
You told me not to do drugs.
You told me not to drink and drive.
You gave me so many messages about how to stay safe. Why didn't you keep me safe by properly storing your gun?
Why don't you ever see elephants hiding in trees? Because they're really good at it. Yeah, I get it.
Because of you, I feel not alone in this world. And you let me know that it only takes one person to make you feel wanted.
All right, welcome back, you guys. If you're just tuning in to the You Didn't Get the Memo show with my awesome guest, Miss Leslie Oldershaw. Look, we are really talking about acupuncture, the benefits of acupuncture. And for those of you who have had some chronic pain, chronic issues, and something Leslie just told, you're talking about, I'm like, yes, knee surgery, and, and those things that can be done to help alleviate that swelling and just that inflammation and the pain. Great information, and I thank you so much for sharing that. Before we went to break, one of the questions that I posed to my guests what can a patient expect when getting acupuncture for the first time? So what does that look like for them if they were walking into your clinic?
Okay, so if they're walking into our clinic, we're going to first sit down with them, and they filled out some forms, and we're going to get a history of what's going on and what has brought them to our clinic. And then we're going to have them relax on a treatment table. It's a massage table. It's very comfortable. And then we're going to insert the needles at different points on the body. A typical treatment might involve 10 needles spread out. And then they're going to relax for usually about half an hour on the table with the needles in. Most people fall asleep and take a really nice short nap. And then we come in and take the needles out, and they feel refreshed and relaxed. And depending on what we're treating, they usually feel some relief from the pain that they came in with to start.
Okay, so history.
Mm-hmm.
First of all, alleviating any concerns that I can certainly say that I know that coming in, how you just put people at ease. But even if you were going into any acupuncture clinic, you would hope that the vibe would be that it's about making you feel comfortable and relaxed, because there's always a little level of nervousness in the first place. But after the first time, I just think about my first time when I saw you years ago, and it was like completely the opposite of what I had even imagined, and it's just magical. Let me just say that.
Oh, thank you.
It was magical, and talk about really doing your work. I mean, people talk about the needles, and I'm like, I didn't feel anything.
Yeah.
It was absolutely nothing. So you guys, if you have concerns, I just want to tell you nothing to worry about. So the question is, how often should someone though get acupuncture? Because you had said, depending on early on in our discussion, you said kind of depending on what the person has going on. But when I think where I'm going with this question is this where someone may come in once a week or twice a week to get acupuncture, or is there such a thing as, with massage? Sometimes I think I want to go have a massage every day.
Right.
But I don't think acupuncture works that way. So tell us a little
So,
bit about how often someone can get
sure.
acupuncture.
So it depends again on the patient and what's going on for them. But let's say it's somebody who has injured their back, and in the beginning they're in a lot of pain. We might have them come in twice a week so we can really get things shifted quickly. And maybe they come in twice a week for 3 weeks, and now their back is starting to feel a lot better. We might then have them reduce their frequency to once a week, and we might have them come in then for another 6 weeks. And if they're feeling really good at that point, then we might have them stretch it out to come back in 2 or 3 weeks, see how you're doing. And then we just pay attention to how they're feeling. Some people, they have an injury, we treat them, they get better, they're done. Other people, they may have chronic back pain, and we find that if they come in once or twice a month on a regular basis, it keeps it so their back doesn't hurt. So we're really going to individualize the treatment frequency based on the patient and what their pain levels are and what kind of relief they're getting and how frequently they need to come in to keep feeling good. And a lot of it really just depends on the patient's response.
Right. Okay. So what are the different things that acupuncture can treat? So now I'm going to circle back around to us talking about how your clinic works with an integrative approach, and the types of acupuncture treatments. What are things? Because I see some people are, we've heard some questions about arthritis and what have you, but you also, when I think of all encompassing, we're talking about diet, we're talking about lifestyle, lab testing, those types of things. So tell our viewers a little bit about all of that particular integrative approach.
Okay, so let me start by saying acupuncture itself is great at treating any kind of pain, whether that is from arthritis or an injury or something else that's causing the pain. Acupuncture is great at treating any kind of pain. In our practice, we work with pain. Again, we're doing a lot of work primarily in women's health. And so in addition to using the acupuncture, we're also often looking at blood work. We look at a lot of hormone levels. We work with nutrition. So we look at diet. What are people eating? How might that be working for them or working against them? And we'll give them feedback on how we think they might modify what they're eating. And then we work with supplements. Again, we don't go overboard here, but for instance, if a patient is hoping to become pregnant soon, we're going to be recommending a prenatal vitamin. And then we'll also talk to people about lifestyle. So, are they getting enough sleep? Are they able to sleep? Insomnia or having difficulty sleeping can be something that we can address with our work. And if that's going on for people, then we want to figure out how we can get them sleeping better. Are they getting enough exercise? Are they getting too much exercise? So we're talking to people about their overall health and well-being. And that includes, the acupuncture. We look at lab work. We're making dietary recommendations. We might be talking to them about what supplements to take. Sometimes we're talking to them about what supplements they don't need to take. Patients will come into our office and they're taking, 20 different things. They're like, you don't really need to take all of this. We'll talk to them about what kind of exercise might be best suited for them. Make sure they are able to sleep well, and then talk to them also. Almost everyone these days needs some support around stress management. So we include all of that in the work that we do with our patients.
That's an understatement, Leslie. Stress management. If nothing else, all acupuncturists should be extremely busy during this period of time and what's going on. But I really appreciate that. Someone wanted to know about plantar fasciitis.
Uh-huh.
So,
Yeah.
can acupuncture actually help plantar
Yes, it
fasciitis?
can. And plantar fasciitis is such a challenging thing because if you've got it, it can be hard just to walk. And we've had a lot of success with patients over the years working with plantar fasciitis.
Another viewer, and I want to say for some of you who are on YouTube, and if you are able to translate your questions into English, that would be very helpful since I don't speak. It looks like maybe Chinese. So, but please, we want to answer your questions. So if you're able to hit translate, please do so. We have a question here. What about nerve damage?
Nerve damage. Nerves and nerve damage itself can be difficult no matter what system of medicine you're using. We've seen some real success with acupuncture. We've also seen cases where the acupuncture has not been able to really reverse the nerve damage. So it's something that you have to try and see if it's going to work for you.
Okay. All right. But thank you for the question. I love this, the interactiveness that people can get their questions answered. All right. So here's another one. Acupuncture, is it safe for children? And if so, what ages? And what would you be treating? Like, is it ADD or ADHD?
Right.
So talk about that, please.
Okay, so acupuncture is great for kids. It's been used historically for children. So pediatric acupuncture is a specialty. It's great for, again, if kids are in pain or they're having digestive issues or they've got a cold or any of the kind of issues that come up in general for kids. Something like ADHD, the acupuncture could work, but again, that would very likely always be done in conjunction with what the parents are doing in terms of Western medicine, and you would be wanting to work with an acupuncturist who's going to be collaborating with your pediatrician to make sure that the kids are being well taken care of on all fronts.
Absolutely. And the one thing, even though we didn't really touch on it, but let's just talk about people who have headaches, chronic headaches, migraines, how acupuncture can actually help with that.
Right. So acupuncture can work great for headaches and migraines. Anybody who's got chronic headaches or chronic migraines knows that they can be very tricky figuring out what triggers them, figuring out how to manage them. You can have 10 different people with chronic migraines and you'll have 10 different triggers, and you may have 10 different ways to address those different patients. And so generally for our migraine patients, and migraines are something that affect women quite a bit. So we see a lot of migraine and headache patients in our clinic, is that, we're always working in conjunction with what they're doing with Western medicine. And the acupuncture itself can be very, very helpful. They will often also continue to take Western medication as needed to help manage the migraines. And so the beautiful thing about acupuncture is that it's not contraindicated. You can use it along with any medication you're taking. And then, we're often helping the patients sort through if they have, what their triggers are and helping them to identify those triggers. And the great thing about acupuncture is that, patients will be coming in and seeing us. Say they're coming in once a week. We have the opportunity to work with them on an ongoing basis to kind of sort through what things may be triggering them. And with with migraines in particular, there's very often, not always, but very often, a food trigger, but sometimes it can be hard to figure out what that trigger is. And so a lot of what we're able to do with patients is to help them, figure out what is contributing to the headaches and what can we do and what can they do to really help manage it so they're having far fewer headaches.
Yeah. All right. Now here's this is the big kahuna. This is what everyone's probably waiting for. Let's talk about acupuncture and weight management.
Okay.
That's been a big thing. And I know for me personally, with the entire pandemic and with just other health conditions and medications I've been on, you end up putting on extra pounds, and it's like, OMG, right? So can we talk about how acupuncture works in helping you to lose weight?
Sure. So the way acupuncture is going to help you lose weight is working with an acupuncturist who's able to address, different aspects of weight loss. So, in our clinic, if someone comes in and weight loss is their primary goal, first of all, we're going to be doing an intake with them and getting a sense of what is their health history. And we're going to be doing blood work and looking at things like their hormone levels. Is there something going on with their thyroid that is making it hard for them to lose weight or is causing them to gain weight? So, evaluating them for anything that may be contributing to the weight gain that we can address through whether it's medication or other ways of figuring out, what is the key to their success for weight loss. Then we're going to typically do a food journal and have them bring in what they're eating, and we're going to help them look at their food intake and figure out what we think is going to work in terms of the type of food and diet they're eating and how much they're eating. We may have them use an app to track their meals so we get some quantitative numbers to look at, and we're going to help them figure out again what do they need, what does their body need in order to lose weight. And we'll be talking to them about exercise. Not getting enough sleep can make it very hard to lose weight. So if they're having troubles with insomnia, we'll be addressing the insomnia. And we know, once you're sleeping better, that makes it a lot easier to lose weight. If your body is having a lot of stress, that makes it easy to gain weight, hard to lose weight. So we'll look at what's causing the stress and how can we minimize that. So we're working with our patients to understand all the different factors that can make it easy to gain weight and make it hard to lose weight. And we're looking to find, ways to resolve those issues so that they can get to their optimal weight.
Yeah, absolutely. Okay, so we're going to take a really, really quick break right here. And when we come back, Leslie, I would like for you to share with us what is it that you want viewers who are watching the show today, what is it that you want them to take away? So guys, thank you so much for your questions. I really appreciate all of you. We will be right back, so don't go anywhere. Don't go anywhere, Leslie.
Okay.
Thank you for watching the You Didn't Get the Memo show with your inspirational host, Gloria Bailey Ray. It's your contributions that make this happen. To become a sponsor, send an email to youdidn'tgetthememo@gmail.com. That's the letter U, didn't get the memo. If you're not in a space to be a sponsor, but you like what you hear, we simply ask that you support what you like by making a contribution to the show. There are 3 ways to make an online donation. Visit paypal.me/Gloria Bailey Ray or Cash App or Venmo, Gloria Bailey Ray. Give what you can. Your support is appreciated.
All right, guys, the time flies by when you have a great guest and you're getting a lot of questions. Before we took that short break, I had asked my guest, Miss Leslie Oldershaw, to share with us what is it that she wants viewers to take away from today's show? So, Leslie, I'm going to punt that to you. I know that we've covered a lot of things in a short amount of time, but if there are a few things that you would like the viewers to take away, what would those things be?
Yeah. Well, I would say first and foremost, if you've been thinking about getting acupuncture or you're thinking about it now, I would encourage you to do so. It's a very safe way to address a lot of different health issues, including and especially pain. And it can be something that really is a game changer for people. I think the second thing I would want people to take away is that, being responsible for your health is so important these days. It's getting harder and harder to find one person, one doctor or health professional who can answer all of your questions. And so a lot of what we do in my clinic is we help patients learn how to be better advocates for themselves, how to really take charge of their health, because what's going to keep you healthy for many, many years to come is knowing what you need to do for your own health and well-being. And that's what I would leave people with.
All right. So I want to thank you again, Leslie, for being on the show. And I would say don't go anywhere. To our viewers, I want to again just thank you so much for being here. I'm going to ask that you like, share, follow me on Facebook, YouTube, LinkedIn, Instagram. I am all over. So be sure and check me out. And, hey, let's do this together. This is what this show is about. If you want to support our efforts, I really want to just remind you, you can inquire about our sponsorship packages by going to or sending an email to you, the letter U, didn't get the memo, at gmail.com. And someone will get back to you in regards to that. And if you are not in the space to become a sponsor, you can still support and make a donation. Again, I want to remind all of you to be sure and follow me on all of my social media platforms and mark your calendars, guys, for every Tuesday, 5 p.m. Pacific Standard Time, to be sure and tune in. It's been a blast. And as I always say, if you guys didn't take anything away from today's show, then it's really you who didn't get the memo. The thought for the week is just simply this: the quality of your life is determined by the decisions that you make. Until this time next week, have a great week. Give thanks for all of your blessings. Stay safe and always remember to pay it forward. I'm Gloria Bailey Ray, your host. Peace and blessings.
Yeah.